Sure. Please come in. I've been waiting for you, actually. No, you're exactly on time. No worries about that. Yeah, you're an extremely punctual patient. We're really grateful for that, by the way. Yeah. Well, how are you doing today? And how have you been feeling lately? Right. Okay. Yeah. Well, have you had any complaints about any of your senses, like your eyesight, your hearing? Maybe something related to the sense of taste or smell. Maybe the general, body, like how your muscles react to the exercising. Any kind of dizziness in the morning, especially. Any flashes in front of your eyes when you wake up. Okay. Well, I see. And what about your lifestyle? Can you tell me more? How often do you exercise? Yeah. Do you usually have muscle sore afterwards? Any kind of unusual, really strong muscle sore? What about your balance and coordination? Have you noticed any changes recently? Okay. Well, and what about your, I would say that the general balance. And how much sleep do you have? Okay. Have you been deprived of sleep lately? Right. Okay. Yeah, I see. Well, and any other kind of symptoms? Okay. When was the last time you had a cold? And what symptoms did you have? Did you have any kind of a sore throat, cough, sneezing, runny nose, fever? Yeah. Okay. Have you had any injuries or accidents lately? Maybe there was something that happened recently that you kind of feel might be related to the way you feel, the way you've been feeling. No, it's fine. Well, I'm sure that we'll find the reason for that. And actually, do you have any questions? You can ask me anything, anytime during our session, during this checkup. You can ask me any questions you want, okay? Please don't hesitate. You can trust me, you can rely on me. There are no stupid or silly questions when it comes to your health and your well-being, okay? So, please don't hesitate. I just want you to feel comfortable enough. By the way, do you feel comfortable sitting in that chair? Is it alright? Can I get you maybe another pillow or like some kind of a cushion to... No, it's fine. Are you sure? Would you like some water? Okay. Please do let me know in case you need something. In case there's anything I can do for you, okay? I'll be willing to. Okay, great. Well, I believe that we have all of your personal data right here in the system. Could you please remind me your first name once again? Right, that's it. And your last name? Okay. Now your email address, could you spell it for me, please? Great. And what about your home address? Is it still the same? Okay. Yeah, I believe that. Yeah, that's what we have. Okay. Anyway, are you ready to start? Okay. if you think that you're ready, that means that, yeah. Alright, well, I guess that I would check your reflexes first, if you don't mind, of course. That's quite easy. It's not gonna take too much time. It's not gonna hurt. I know that this hammer might look a bit, I don't know, a bit weird or something, but I will just touch you slightly with this rubber pot, and it's quite soft, so it's not gonna hurt, I promise. So the main task here is just to see if your reflexes, is everything is in place, and if everything is working the way it should. Okay, so just relax. I will do your wrist first. Good. Wonderful. Okay, now let me have a look at your elbows. No, just keep them this way, the way it is. Okay, that's perfect. Good. Okay, great. Now let me have a look at your knees. What I need you to do is, so we're gonna check your knee jerk reflex, and would you please bend your knees and put one knee over the other, yeah, one leg over the other one. Yeah, perfect. Okay, awesome. Yeah, no, just sit still. Okay, that's it. Now, would you please switch them? Thank you. Good. Now, your feet. Just for a moment. No, no worries. No, you can just hold still. It's fine. Good. And now the other one. Perfect. Okay. Now everything is working just fine. Alrighty. Well, would you please shrug your shoulders for me? Perfect. Now, would you please raise them? Please don't let me put them down. Okay. Okay. Awesome. Well, thank you. Now, would you please put your hands like this, your arms actually, okay? And just hold there. So I will try to push you slightly. Try to resist me, okay? Okay, perfect. Now would you please put your ear closer to your shoulder like that? Exactly. And please fix your head in this position. I will try to move it. Don't let me do that, okay? Okay, wonderful. And now with the other way, to the other side. Great. Now you can resist me quite well, so that's perfect. Now, would you please smile at me? Like, give me the widest smile possible. Amazing. Thank you. Well, now I will try to kind of like raise your chin, but you put it down, okay? So don't let me raise it like that. Alright, okay, perfect. And now would you please look up for a moment? Now hold there, please. Oh my god, look. Okay, now the other one. Alright, now let me have a look at the pupil reaction to the light. Now everything is the way it's supposed to be, so your pupils are supposed to shrink in size a tiny little bit when they're exposed to this bright light, okay? So now let me have a look at these, like other eye. Okay. Okay, wonderful. Alright, then the area around your eyes. Does it ever hurt? Do you ever feel any kind of sore in your eyes? Do you spend a lot of time in front of the screen, in front of computer, maybe a phone, tablet, any kind of device? That's too bad. That's too bad, my friend. Well, I know that, of course. We'll need to work, we'll need to do stuff, and sometimes it can be fun to watch a movie or play some game, but please make sure to have enough rest, okay? I'm talking about your eyes, exactly, yeah. Because, yeah, it can be too bad, and the consequences of staring at the screen for too long, yeah, they are not pleasant at all. At least if you have to look at the screen for a while for work or something like that, so something you can't avoid, something that you have to do on a daily basis, please make sure to do some kind of exercises in between those tasks, okay? At least every hour. Yeah, I'll show you everything, yeah, after this checkup. There are actually plenty of videos with exercises and some explanations how to do them right, so I'm pretty sure that, yeah, you'll nail it. There's nothing challenging, but we will share all these materials with you. We have your email address after all, okay? Okay, great. Well, now, so the reflexes are working just fine. The muscles, the musculature in your body seems to be working just fine as well. Okay, could you also please puff your cheeks? Like this, exactly. That's right. I'll try to close them. Don't let me do that. Don't worry. No, of course, I have washed my hands right before our session, so it's fine. I might also put on the latex gloves later when I'm about to extract your nose, your mouth cavity, because, yeah, then it will be a must. But for now, yeah, it's just fine this way. Alright, so now would you please blink for me? And once again, blink. And now blink once again. Perfect. Okay, excellent. Now, I'd like to see if you can breathe with both of your nostrils evenly. Would you please close one of your nostrils like that? Yeah, you can do it yourself. I can help you if you want, but yeah, you can do it perfectly fine. Okay, so close one of your nostrils, please. Press it against the septum. Okay, and would you please breathe in and breathe out? Okay, perfect. And now with the other one, breathe in, breathe out. Is there any kind of nasal congestion in there? Okay. Well, I do believe that we could use these kind of drops. Right, let me put on my gloves for a moment. After we're done with your nose, with your nasal cavity, I will just have a short look, a brief look at your mouth, at your throat and stuff. So once again, you said that the last time you experienced some kind of a sore throat, it was... Got it. Okay. So, your nose. I would ask you to tilt your head that way. Yeah, exactly. I will put a few drops of the substance in both of your nostrils. Okay, if you don't mind. It's not gonna hurt or burn or something. It's totally harmless. Don't worry. It actually has a nice eucalyptus smell, scent if you wish. So it's very pleasant. Very like. Okay, you can trust me on that. Okay, good. Good. And now the other nostril. Can you give me a moment, please? Right. Okay. Yeah, you can stay in that position for a few more seconds. Thank you. Amazing. Okay. I promise you'll feel better very soon. So now let me have a look at your throat, at your mouth. I will use a spatula. Yeah. It's clean. We have disposable ones, so it's... Yeah. Of course, we also put sanitizer, like we spray sanitizer all over it just in case. But yeah, we do use these individual ones for every patient, and later we just throw them away. So don't worry about that, please. It's fine. But I like that you're so conscious about all this stuff, and that it's a good sign. you know, when people actually kind of worry, they are going to be aware of their health and some possible problems and stuff. It's definitely better than when people don't care at all. So the regular checkups and stuff like that is actually it's pretty important. Okay, so open your mouth, please. Okay, let me have a look at it this way. Right. Now, would you please stick out your tongue? Exactly. Now that will do. Okay, I will press against it slightly with a spatula. Let me have a closer look. No, everything seems to be just fine. The palate, the uvula, the gingiva, even like the throat is fine. It's like I don't see any redness as well in there, so it's fine. Okay, do you please cough for me? Perfect. Okay, thank you. No, that's fine. I will actually listen to your lungs a bit later, just in a moment. But for now, I don't hear anything suspicious there. Okay. Now, would you please? Okay. You know, I'll just take a sample of your saliva for a test. Yeah, that's fine. Would you please open your mouth for another moment? Okay, perfect, thank you. Yeah, the results of the test will be available in a few days. We will email them to you, and just in case there's something wrong with them, we will ask you to come for another appointment, but I'm pretty sure it's gonna be alright. So, now let me have a look at your neck. What if I press here? Good, what do I press there? Okay, now I won't press at this spot because you might just faint. That's not what I want. That's not our purpose, at least for now. Okay, anyway, what I'm saying is that everything is alright. So your nose, your throat, your ears. Now let me have a closer look at your ears. When was the last time you had some kind of ear exam or ear cleaning or stuff? What was the result back then? Did you have any complaints? Have you ever had any troubles with hearing or something? No worries, it's fine. No, looks perfect. Actually, there is no excessive wax or something. Okay. No, it's alright. It's alright. Okay, so since we started checking your ears, let's take a short test with a tuning fork. Do you know what it is used for? Okay. Well, you're absolutely right. I will put it behind your ears, as always. Let me know when you stop hearing the sound and the vibration. Okay, perfect. And now, once again. Okay, wonderful. Now, close your eyes for a moment. Can you hear any kind of sound? What kind of sound does it sound like? Okay, great. It's fine. Now please tell me how many claps you can hear, okay? Good. What about now? Good. What about now? Okay, wonderful. What about now? Which side are they on? And what about now? And what about now? They were different sides. Okay, wonderful. Good. So your hearing seems to be just fine. I don't see any problems with it, but I think that it would be actually great to have an extensive ear exam. Like, yeah, with lots of hearing tests of different kinds, maybe some ear cleaning. So, just in case you need that or you feel that you might need that, so yeah, please, you're always welcome. You can always make an appointment at the reception desk, and yeah. Sure. Yeah, usually the patients have to wait for quite a long. We have all doctors are booked most of the time. So what I'm saying is that yeah, the earlier you make an appointment, the better it is. But of course, we can always make an exception, especially for our loyal customers, for our loyal patients. So totally okay. Well, so with the hearing, I guess that will do. Now I have already checked your eyes. So the pupils react to the light just fine. Your blink reflex is working just fine, and I believe that we could examine your eyesight a little bit further. Okay, if you don't mind. Would you please follow my fingers? Perfect. Okay, just with your eyes only. Please don't move your head. No. Okay. Okay, great. Now, look at the light, please. Now keep on looking at the light. And tell me how many fingers I'm holding up with my other hand, okay? But keep on looking at the light right here, okay? Don't look at my hand directly. What about now? Good job. Amazing. And please keep on looking at the light, okay? And tell me how many fingers I'm holding up on my other hand. Okay. Okay, perfect. Okay, now please tell me when the light is in your field of vision, okay? When it appears in your field of vision. Please look at my nose. Okay, now keep looking at my nose and tell me which direction the light comes from. Okay. Okay, great. So thank you so much. Now tell me how many times it appears and disappears, okay? But keep on looking at my nose. Now we are checking your side vision. So for that, you're not supposed to look directly at this item, at the object we are talking about, okay? The light in our case. So please just look in the center. So that would be approximately like my nose for you, okay? Or just my face in general. Okay, are you ready? Good. So let's count how many times you can see the light. Wonderful. Good. 4 times. Amazing. 4 times again. Okay, what about now? 5 times. Okay, what about now? 2. Okay, and now 5 times. And what about now? Twice again. Okay, great. So it's pretty good. It's a fairly good result. Now, about this light, is it any different from the previous one? It's a bit warmer. Okay, awesome. So now please follow it for me with your eyes only, but don't move your head, please. Okay. All right, amazing. Okay, good. Now, talking about your eyesight, I'd like to also check your color blindness, possible color blindness. What color is the tip of this hammer? Oh, it's red, wonderful. What color is the plant behind me? Obviously it's green, but that's quite quite predictable. Okay, so now let's do something a bit more challenging, shall we? Can you see any numbers here? What number is this? Okay. What about this circle? Can you see anything inside? Okay. Great. And what about this one? Can you see anything inside? Oh, amazing. Okay, so you're not colorblind, which is actually great. Now let's test it a bit further. So I have some markers. What color is it? Your opinion? This. Okay. Good job. Great. Thank you. Good. Okay. Amazing. Good. Great. Talking about these two colors. Which one is darker? Okay. Great. And now a bit more challenging. Which one is darker? Can you see any difference between these two shades? Okay. Are you sure? So would you please follow the one that is like more saturated yellow color, okay? It's quite challenging, I know, but you're doing good. Okay, great, thank you. Now, can you see any difference between these two colors? Which one is darker and which one is brighter? Exactly. Could you please follow the brighter, more like neon green for me? Yeah, with your eyes only, don't move your head, please. Okay. Now, which one is closer to you? Okay, great. Amazing, wonderful. Now, would you please tell me if you can see any difference between these two colors? Would you please follow the yellow one for me? Now, these two colors, are they similar? Are they different? Okay. Would you please follow the lighter blue for me? Okay, great, thank you. Now, these two colors, are they similar or different? Which one is a bit lighter? Okay, please follow the darker one for me. Okay, amazing. Okay, great. Thank you. And now finally, these two colors, are they similar or different? Great. Could you please follow the red one for me? Please pay attention. Don't get distracted. Alright. Okay, so the perception of colors is just great, very accurate. Good job. Thank you. Well, now I'd like to listen to your heart and your lungs, and probably your stomach as well. I'll put on the stethoscope. Are you ready? Okay. Would you please breathe in and out and out. Good job. Now once again. Exhale. And now once again. Exhale. Amazing. Now turn your back, please. Okay, breathe in and breathe out. Good job. Could you please cough for me? Okay, good. Now I will ask you to hold your breath, okay? So breathe in and hold there. Breathe out. And now once again. Good job. Okay, now listen to your stomach, okay, for a moment. Wonderful, so everything is just fine. There's nothing to worry about. Okay. Now, let me have another look at your skin as well. Okay, so there seems to be some kind of a rash. Are you allergic to anything? Okay, so I will take a few basic tests. We actually have allergists working at our clinic, but basically I guess that I could do it for now, and maybe later you will have like a full exam. So I will take a few testers. I will just do this test on your skin, on your forearm, okay, if you don't mind. Okay, yeah. So all you need to do is just relax. Do everything myself. So I have some substances, and I'm gonna use them, these testers, to see. Okay. just drop a few, yeah, like a little amount of this thing. Okay. All right. Now take this. Okay. Good. Now the other one. No. Okay. Now let's do it on the same arm. Okay. Just like that. Okay. Now the other one. I will just put a little amount of this liquid. Just like that. And now. Okay, thank you. And 2 more. Great. And now okay. So these are all different kinds of stuff. The things that can cause most allergies in the world, like most common stuff, like dust, pollen, nuts in general. It's mostly peanut, but there can be different kinds of allergies, yeah. And then wheat, eggs, and soy. Okay, so these are also some foods that a lot of people can be allergic to. Okay, very common allergens. Well, good. So the results will be available a bit later too. And now I guess that we could also check your sense of taste and smell, right? Your olfactory nerve. So I will just put. I will first give you a few things to smell. So some basic ones. We do have some testers, but I also have some things, some items with very distinctive scents. Okay, so let's give them a try. So I'll get a few items. So first, would you please take a smell? Don't hurry, it's fine. Coconut. Oh, okay, amazing. Good job. And now, what about this one? It's a candle, actually, but right, yeah, it has this slight smell of cinnamon and some other spices. So cinnamon, this, great. Now, your sense of taste. Okay, open your mouth, stick out your tongue, please, just a little bit. Okay, I'll drop a little amount of this syrup onto your tongue. Now give it a try. Okay. So what does it taste like? Are you sure? Okay, yeah, it's actually mint. Okay, now let's take one more. Great. Okay, good. Now, your skin. So we were talking about this rash that you had. I think that before you have actually visit to like an appointment with your dermatologist, let me take a sample of that skin. Okay. Have some tools. And another one. So let me scratch it slightly. Okay, and now I'll take this little flake of the skin for some further tests. Thank you. Okay, great. Oh, it's good. Don't need to worry about that. I'm pretty sure that it's gonna be alright, but just in case we have to check everything, just to be sure to be on the safe side, since you have like full body exam. Just want to make sure that we take everything into account. Okay? Okay, good. Well, now let me take your pulse after all these tests that we've done. How are you feeling, by the way? Just give me your hand, it's fine. Just have a look at the tongue. Well, now you're doing good, so the pulse is just fine. And how are you feeling, actually? Yeah. Oh, that's great. I'm really glad to hear that. Yeah. Alright. Oh, sure. Don't need to worry about anything. Okay, so I guess that in the nearest future you will have a few different tests related to more like specific fields, like an ear exam, an eye exam, and some other stuff. Yeah, so you'll have also an appointment with your dermatologist, your dentist. You're also supposed to see our like main neurologist for more extended cranial nerve exam as well. Then I also guess that it would be cool to see another doctor, so who would help you with your sleep as well, right? Because at the beginning you mentioned that you don't really have enough sleep, so I think it would be great to, yeah, totally. There is a great sleep clinic. Yeah, it's actually a part of our clinic, but it just specializes in sleep and stuff, so we'll be waiting for you. Sure. Do you have any questions you'd like to ask me? Okay. Okay, great. No need to worry about anything. We'll email you all the results though, okay? And I'm pretty sure that just in case if you have any questions, in case if something goes wrong with those tests that we've done today, of course we'll call you or email you and we'll make another appointment. Yeah, just to discuss those issues, but I'm pretty sure that everything is gonna be just fine. Thank you. Oh, of course. Take care. Yeah. We'll see you soon. Yeah. Have a good one. Bye.